Hi, I'm Dr. Joanne Smith.
And I'm Dr. Corinda Hankins.
And this is A Pod Full of Pediatrics. Subscribe here for more content.
Or go to onecommunityhealth.org.
Or follow us on social media at One Community Gorge. And this is the one where we talk about
Hepatitis A and community immunity.
Which, you love that
I do.
phrase.
I do. So cute.
It's herd immunity, but that sounds like a bunch of cows.
Yeah.
And
So
community immunity sounds
we're just going to
so
say
much more
community
pleasant.
immunity because I like it. And because it just rolls off your tongue.
Yeah, it's a little rhyme.
Plus, it does really get to the point of vaccination and why it's so important. Because it is all about community.
It is. So hepatitis A used to be referred to as a traveler's hepatitis because it was really not prevalent in the U.S. compared to other countries around the world. But now it's here as well as everywhere else.
That's right. And a lot of that is because we are a global community, right? So we import a lot of food from places that have more hepatitis A.
Yes, and people travel a lot.
And especially here, where we live in Hood River, and there's a lot of people who travel to Central America, South America, and beyond.
I mean, Mexico is closer than Europe.
That's right, exactly. So we do see more hepatitis A, and the infection in children is typically an acute self-limited illness associated with pretty general symptoms, fever, fatigue, appetite loss, vomiting, nausea, tummy pain, diarrhea.
Just like a lot of other viruses, right? Yes, it looks a lot like other viruses.
It does.
The difference is that this is a really delayed onset typically. After exposure, it can be 15 to 50 days after exposure before symptoms will show up.
Yeah, and in the first couple of weeks of the illness, liver enzyme tests are typically elevated. And you'll see some of that times with gastroenteritis, but the big difference is that it also hits and causes jaundice, which almost never happens.
Right, it's that lovely shade of skin color that in babies is pretty expected and normal, but anyone else is not.
Yeah. And it usually occurs about 1 week after onset of symptoms, and then you get bilirubin in the urine, and sometimes you get liver swelling.
Yeah, and the interesting part, less than 6 years old, only about 30% of infected children actually have symptoms and become jaundice.
Yeah. When it does occur, jaundice usually lasts for about less than 2 weeks, and most children will recover from it. The abnormal blood tests return to normal within 2 to 3 months.
Yes.
So their liver is not functioning normally for a while.
But then in contrast, older children, greater than 6, and adults with hepatitis A are usually symptomatic for several weeks. About 70% of them are jaundice compared to 30, with the kids. 80% have liver swelling, and 40% will be hospitalized.
40% hospitalized in older children and adults, which is a lot, which is why we kind of talk about why it's important to vaccinate for hepatitis A. Symptoms lasting for up to 6 months have been described.
Yeah.
So again, for the young kids, a few weeks.
Yeah.
But for older kids and adults, 6 months.
Yeah.
And acute liver failure, meaning your liver no longer functions at all, it occurs in about 1% of patients.
And hepatitis A is spread through the fecal-oral route, which
is totally disgusting.
So gross, but it's just the way that kids live, right?
That's right.
Just everything that goes in their mouth.
That's right. And the majority of patients who acquire the illness have had personal contact with an infected person. And in a childcare setting, that's really easy.
Yes, it is. And as we talked about, it's 15 to 50 days before someone might become symptomatic with hepatitis A. So they're spreading it around everywhere before anyone even knows.
Yeah, they're just taking things, licking it, and putting it in the back, and the next kid licks
and licking
it.
each other.
Right. So outbreaks are usually recognized only after the adult people are actually getting sick because they develop symptoms more quickly.
Right, and they develop more severe symptoms.
Yeah, right. And a lot of children always remain symptomatic. That doesn't mean they didn't have it, and that's the problem with it.
So, we talked about hepatitis A is not as severe in kids as in adults. In studies, the hospitalization was only about 13% of children younger than 5 years, compared to that 40% we said earlier for older adults and children.
For
For older children.
Older children and adults.
Older children and adults.
And full clinical recovery is observed within 2 to 3 months in about 85% of patients, which is still good. Complete recovery observed by 6 months in nearly all patients. But they relapse can occur in about 10% of patients. And again, there's that small portion that don't recover and they go to full liver failure, and that's about 1%.
Since 2007, the rates of hepatitis A decreased in all age groups and remained constant until there were some outbreaks of hepatitis A starting around 2016.
And there was a substantial increase in the rates of hepatitis A observed between 2017 and 2019 in almost every age group. So not just your older children and adults, but also like younger children.
Except for the people less than 20 who had received the hepatitis A vaccine, which was the introduction of the universal vaccination started in 2006. Okay. And so those people didn't get sick when everyone else was getting sick.
Yeah, and in 2022, the highest rate of Hep A infection occurred among people 30 to 39. They never got that Hep A vaccine, right?
Right. And so the incidence of the acute Hep A vaccine in the U.S. declined from 12 cases per 100,000 in 1995.
Infection, not vaccine.
Sorry. Acute hepatitis infection in the U.S. declined from 12 cases per 100,000 in 1995 prior to the vaccine to about 0.4 cases per 100,000 in 2011.
And the declines were greatest in the states in which routine vaccination was actually initiated earlier. Right. Because the initial states that instituted it were the states that actually were along the borders, right? Like where we saw more hepatitis A infection come because they kind of shared food more. But then, interestingly, what we saw happening is that those states were actually really declined well, but the other states were having the outbreaks of infection. And it's because we import food. Right. So that food came across and went to different places, and then all of a sudden they were like, maybe it's better if we do universal vaccination, and that's what happened in 2006.
So in January 2006, the Hep A vaccine was added to the recommended childhood and adolescent immunization schedule in the U.S., even though some states had been giving it since 1999.
And this is really important because they just took this away from the adolescent immunization, according to the Health and Human Services. And there's really no reason or evidence that we should not be doing hepatitis A. And hepatitis vaccine is still recommended from the American Academy of Pediatrics.
Yeah, we stand behind it. And, the reasons we do is, yes, it decreases the amount of illness in children. But the deal is, if you get this older, you're going to be sicker with it.
Yeah.
Right?
And it works really well, and it's a really easy vaccine, and we recommend it for all kids really as they start to eat. We're not giving it to babies,
right?
But as they're starting to eat food that might actually have hepatitis A in it, that's when we recommend it.
And so it's a 2-dose vaccine. 12 months is the youngest we give it, and then 6 months later is the second dose.
And universal vaccination, again, is recommended because it tends to be more severe at those older ages. Hepatitis A vaccine was actually developed not in the U.S.
Nope. In 1992 is where the first vaccine was developed in China, and because they had a problem and they recognized it, right?
And really the other vaccines came from, again, other countries that had a lot more hepatitis A burden than we did. So your first licensed vaccine was called Havrix. That was developed in early 1992 and licensed in China, and then Vacta, which in 1993. And since then, there's been 4 other vaccines licensed in different countries around the world.
In the U.S., universal vaccine since 2006 was reported to prevent annually 94,957 infections,
46,179 outpatient visits,
1,286 hospitalizations,
and 15 deaths.
So this vaccine is truly cost effective.
That's right.
The cool thing about this vaccine, too, is that there is no treatment for hepatitis A illness. When you get it, it's all supportive treatment, and as part of the supportive treatment is immunoglobulins. IVIG is a product that's a blood product, right? It's kind of derived from blood donations that is like a big dose of immunoglobulins. It's like, here, I'm going to help you fight something off.
Right. And you usually did it after you were exposed. Again, like a lot of people might not be symptomatic and you might not know it, so they might not be able to get it in that. But if you had like a person that you were exposed to, you got exposed, you could potentially have done IVIG. IVIG is really expensive.
It is.
Because it is a blood product that has to be like specially made. And it actually has some pretty significant side effects, and it's not easy to give.
Yeah. But the hepatitis A vaccine actually can be used for post-exposure prophylaxis.
Isn't that cool?
I know, it's really cool. It's like if you can't get it before to prevent it, you can get it afterwards.
But it works better before.
It works better before. Absolutely. You don't want to get sick to try it, but it actually is the standard of care now to use as post-exposure prophylaxis to do the vaccine.
Especially in other countries, but even here.
Yeah.
There's not a lot of vaccine side effects for hepatitis A.
It's a really well-tolerated vaccine.
It is. It's really easy. In fact, I call it one of our easiest vaccines. I typically don't see anything but like pain at the injection site.
Right.
It can have
grumpy baby, but it's a toddler. They're
Yeah.
just grumpy sometimes.
Yeah, and low-grade fever can be, but I don't see it very often. So again, I consider this one of the easiest vaccines to give.
And people say, well, there's barely any hepatitis A in our community. Why do I even need to get the vaccine?
Okay, so we're going to talk about community immunity. See, this is my thing. I love it. It's such a great
It sounds
word.
like Mr. Rogers. I really feel like there should be a song about community immunity. Da, da, da. Be a good neighbor,
Especially with recent outbreaks like measles and really a horribly rough influenza season. It's really important to talk about community immunity.
Yes. So, this is basically when enough people in the area have immunity, either from having the disease or the vaccine, that the disease can't spread in the community anymore.
Right. It usually takes a large number of people either getting vaccinated or infected with the germ to achieve herd or community immunity.
And the benefits of it are you can stop a disease from spreading in a particular area.
Stop a disease from spreading worldwide. That's eradication. That is really our goal.
And it's our goal to get rid of these diseases. Remember the first podcast we talked about, we're trying to get rid of our jobs. We're trying to prevent illness.
That's right.
So we're protecting people from serious illness and death.
And then we protect people who can't get vaccinated. And this is really important, or who don't develop immunity when they are vaccinated. So for those people who are immune for or immunosuppressed for some reason, they have cancer or another autoimmune disease, and they can't get vaccinated with these specific vaccines, or they just don't develop immunity. Like there are some people who truly just no matter how many times you give them the vaccine or they're exposed to it, will not develop immunity to that organism.
And the ones that are nearest and dearest to our heart, the babies.
Yes.
It's to protect the babies, right? Because we do start vaccinating babies, but we do know that those vaccines are not going to fully protect them until they've had all their boosters. And so really getting this herd immunity is so important for those babies.
And herd immunity is not permanent.
Yeah, we're learning that the hard way right now.
We are really learning it the hard way. Unless a disease no longer exists anywhere in the world again, it will start spreading again. And that usually happens if someone without natural or vaccine immunity gets infected while traveling to an area, and then the disease just spreads.
And we were, at that point, we've eradicated smallpox, right, by doing this herd immunity. We were so close to getting rid of polio, and the U.S. actually was eradicated from measles until recently.
Yeah. And I like to think of community immunity, and this was actually from, it is not my metaphor.
But you love it.
But I love it. It's really cute. And it's from the Boost Oregon website and what they talk about. And they think about community immunity as like this community garden filled with healthy vegetables and beautiful flowers, right? Illnesses are actually the weeds that come in and really choke the vegetables and flowers and keep them from growing. They take all their nutrients away, and they don't allow them to stay healthy. Vaccines are all those really amazing community members.
Those volunteers.
Like those volunteers who come and weed your garden. They pick out all the bad things, right? And they are what allow our children or our healthy vegetables and beautiful flowers to keep being growing and being healthy. If they look at that garden and say, you know what, that is a beautiful garden. You don't really need me. I don't need to come and weed anymore. So I don't need those vaccines because I'm in a community that's already healthy, right? But I'm not going to weed anymore. I'm not going to do those vaccines. And if all of a sudden you stop weeding, guess what comes back? like all of those weeds come back. They start choking and making children and adults less healthy, and making this garden look less healthy, or be less healthy, truly be less healthy. And so it's really important. We have to keep weeding. We have to keep giving vaccines and boosters on a regular basis to make sure that all of our children, all of the plants in our garden, stay healthy.
Do you like this because it reminds you of your garden?
No, because my garden sucks.
I know what I'm saying, because we need community members to come weed your garden so we can get those vegetables back.
Well, that would be great, but I don't think it's going to happen.
I'll get my daughter on it.
Yeah.
So, the challenges in reaching herd immunity are multiple, right? One is there's just some viruses that just change a lot. So we see that with norovirus, right? That gross virus that causes you stomach flu, vomiting, diarrhea, and you can get it like twice in a week because it changes and, you
mutates
just get it
fast,
back, right?
Yeah, and so when they have really fast mutation times, like a vaccine isn't going to be as helpful, and you're never going to reach community immunity because it's changing so fast that even if you developed a vaccine for it, it wouldn't be good enough for the next one. And sometimes you see this with like even influenza, right? The cool thing about influenza is that it's usually similar enough that the vaccine is still effective.
Recognize it, yes.
Where the vaccine is still effective, even if it doesn't stop it completely from from you getting infected with it.
The other is sometimes germs can spread, like hepatitis A. That virus can spread without having symptoms, and so it's really hard to get herd immunity because people are getting it even before they get a chance.
Yeah, or the immunity just doesn't last long enough to your immunity itself comes over with really fast. You get the disease, like you develop antibodies, but then your body kind of gets rid of those antibodies, and
that's a lot of cold viruses.
Cold viruses are just really hard to make successful antibodies to.
Yeah, and then there's some germs that are just found in nature, like tetanus is a bacteria that lives in the soil. So we're never going to get herd immunity to that, right?
Right.
Because there's always going to be some soil with some tetanus in there.
They can protect you personally from those infections. Vaccines can, like tetanus, but you will never get population immunity. So can herd immunity be achieved without vaccines?
No, because for all the reasons we just said above, right? I mean, you have to have a large number of people get sick to get that herd immunity, and we saw with COVID-19, that was not a good plan.
No.
A lot of people died. Super unethical to
died.
create the herd immunity without some prevention of disease.
Right, because that means, over 1 million died. And if you look at what happened before we had the vaccine, many, many more, hundreds of thousands would have died if we hadn't had the vaccine.
Yeah.
So again, the disease just keeps spreading, new people getting infected, and it's really unethical to allow that potentially deadly viruses to spread this way on purpose.
So that brings us back to what we started with, measles, right? So,
and this just makes me so sad.
It does. It's really hard to see it happen. But just a few weeks, we're only at the middle of February right now. There's been 733 confirmed measles cases reported in the U.S. in 2026 so far.
And last year, there were over 2,200 cases. And let's put this a little bit into perspective, because in all of the years since 2000, so between 2000 and 2025, we only had 180 measles cases.
Yeah, it's not even
total.
1 a year.
Yeah.
And now we had 2,200 last year, and so far it's been basically 1 month into the year, and we've had 733.
Yeah, and at least 3 deaths now, and so many hospitalizations, so much morbidity, people missing work, missing school, being hospitalized, going to emergency rooms, and then they're all at now lifetime risk. Everybody who's had this has lifetime risks for like your subsclerosing panencephalitis.
Yes,
like
we remember in our second podcast we talked about that's a disease that can show up at any time after you've had measles.
Yeah. Measles is the most contagious virus on Earth. Look, so listen to that. The most contagious virus, like even small drops in vaccination coverage given an opening. And that's exactly what we're seeing.
Yes. And so it used to be that, basically U.S. had zero measles cases some year. A lot of other countries were that way too. And now several countries have lost that elimination status.
And that means measles just no longer a random event in these countries. It's becoming more endemic and then spreading easily. And that's due to a lot of reasons. Some just global financial, political instability, right?
It's hard to keep ahead of a program when the government is not there to support the vaccination.
Right. And then we have really a radically changed online information system where a lot of just not true information is spread. And there's no limits on it. Like anybody can post anything they want. It doesn't have to be true.
And now we have AI. We have lots and lots of posts being generated. Just you can't even keep up with them, how fast these generation of posts are happening.
And we have a deepening mistrust in our institutions. And what we're seeing then are these really large outbreaks. That's really the cause, because of all of these things. And you had your large outbreaks in Texas last year, now an even larger one in South Carolina. Mm-hmm. We also have Utah, Arizona, and then even some of the ICE detention centers now have been reporting.
And kind of our current population for the last 2 to 3 generations, we've been free from these vaccine preventable illnesses. Like, I've never seen measles. You've only seen it in
other
Africa,
countries,
right?
Yeah.
And so a lot of people did not grow up with this scare and this fear of diseases of, our contemporaries. And so they've forgotten how terrible these diseases are because vaccines have been so successful that now we're like, we don't need them.
Vaccines are really a victim of their own success. They truly are.
I feel bad for them.
I know.
I feel bad for us, really.
I feel really bad for us.
Yeah.
But what this means for you, if you're vaccinated, you are very well protected. About 96% of all the cases we have seen in the U.S. In the last year and a half, or actually a year and a month, are all in unvaccinated people.
Right.
So if you have a child under 12 months old, you can get an early MMR. Like usually we don't give it to 12 months, but it's actually approved down to age 6 months. Mm-hmm. It just doesn't last as long. The protection doesn't last as long if you give it early,
But it's totally safe to give early.
It is
and so
absolutely.
If you hear about measles being close to your community, it's totally safe to get your baby a vaccine.
And then the first vaccine is really effective, but the second vaccine really even ups your immunity. So you can also get that second vaccine early if you need to.
The other part we need to talk about is influenza, because this is a terrible influenza season so far.
Oh, it's so horrible.
Yeah.
It's the highest rate of complications from flu since 1997 and 1998. And nearly 30 years, we have not seen this degree of flu and their complications from it.
And it seems to be the worst for kids. The highest
it's bad.
ER visits are kids age 5 to 17, with the less than 5 being close behind, and they're going to pick up soon.
And there's already been 54 children who have died from flu so far this season. That is actually probably an underestimation. That was from the end of January. And we've even had a somewhat local case of a child death from complications from influenza. So I know that number's higher. I can't tell you exactly what it is.
Yeah.
For context, last year, we set the record for pediatric flu deaths with 280. And this season looks worse.
Yeah.
So we had not had this many childhood deaths from flu last season at this time.
And there's some theory it's because we have less vaccination with the flu, right?
Yeah.
Right now it's about 43%. But it's not too late. It's not too late for you to get your flu vaccine. And again, it's not a perfect vaccine. It's not going to maybe stop you getting the flu. It's going to stop you getting really sick with the flu.
Right, and that's because one of the the latest offshoot, again, viruses mutate.
Right.
One of the mutations that has happened now, it's the H3N2 variant, and it's a slightly updated version, meaning that the vaccine that we have, it actually is we are protecting against something similar, but not that
the exact one.
Which means that we do have some protection. And I think you and I see this in our office a lot. Right. Children that have come in non-vaccinated seem to be a lot sicker, having more of the complications like pneumonias, secondary infections, versus those children who have been vaccinated, who still are sick. I mean, it's not like they didn't get flu,
but they have 1 to 2 days of illness
sick.
instead of 7.
Yeah,
Right?
and often don't get the secondary infections.
And despite changes to the vaccine schedule by the HHS, the American Academy of Pediatrics, which we are proud members,
Yes.
still recommends the flu shot for everyone 6 months and up. It's very safe, and just get it.
Yeah, and if you do get sick, go see your doctor or your primary care provider, because there are actually some prescription antivirals which can truly help mitigate the effects of flu. And that's even if you got the vaccine. Like if
Right.
you especially if you're have a child who's have some health problems, asthma or other heart disease and that type of thing. We have even gotten the vaccine if they get sick with flu. Like these antivirals can help them get through a little bit easier.
So Tamiflu and Xofluza, those are the 2 medications that are available for kids. They can also be used as prophylaxis, for prevention. Like someone is sick in the family and you have a high-risk person at home, they can take Tamiflu as prophylaxis so they won't get the flu.
Yeah, and it is really important to recognize that, again, if you're getting vaccinated, you're not only helping you, but you're helping your community with this.
For sure.
And what we see are years where and this is why we really don't agree with the HHS recommendation, but the years where there's higher vaccination, we just have less flu severity, less morbidity, less mortality, which means that the complications from flu are less, and you have less hospitalizations, emergency room visits, even visits to your doctor's office. And so the vaccine is very safe, very effective, and we really want to emphasize using it. And antivirals are safe too.
They are. There has been some falsehood spread. The Tamiflu is not safe for kids. It can cause hallucinations. It's not true. I mean, flu can cause you to have hallucinations, and so how do you differentiate that when you're taking a medicine? But they've done studies to show that it really is probably not the medicine, it's the disease.
Right. Flu often will cause, because you're having really high fevers and for long periods of time getting dehydrated, it can cause things like hallucination and delirium, confusion. And so it is likely the flu that's causing all of those things, not Tamiflu.
Yeah, there was even a study that showed that the use of Tamiflu actually decreased your risk of those hallucinations than just flu alone.
And this idea that Tamiflu was made from star anise, and so you can just drink star anise tea and get all of the benefits of Tamiflu.
It's fine to make that tea. It's safe, but it's not going to actually help your flu at all.
No, it's not. Because it's specifically Tamiflu is derived from a specific shishimic acid, which is...
you said that pretty well.
I
That
did.
was good.
I did
That
better
was
that
really
time.
nice. Yeah.
I know. Found in star anise, but it's just the starting material. They developed that from this. Again, scientists look at nature and say, hey, this thing might help a little, but we're going to make it even better. And that's actually where our medicines and vaccines come from.
Yes. And Tamiflu actually is really effective. Like in the first 48 hours of illness,
it does have to be used early.
It has to be done early in the illness, and then actually decreases the numbers of days of illness, and it also prevents the complications for most people.
And usually how sick you really get from it, which is really nice. And so if you or your child get sick in this season, get tested early and actually go and ask for the test. Say, if you're going someplace, say, no, I actually want to know if I have flu because I can get Tamiflu or another thing to help.
Yeah.
Get vaccinated. If you're not high risk, you can talk to your clinician about whether that treatment makes sense for you. But, a lot of primary care doctors say,
I would say, and get vaccinated for the flu, but also get vaccinated for hepatitis A, because that was what this one was about. As an adult, I have one of my friend's mom got hepatitis A from going to England, which,
it's not even a place we think about.
And there's been multiple outbreaks here from frozen juice or...
There was blueberries.
So just as an adult, if you don't have the vaccine, get the vaccine, and please get it for your child.
Yeah. And then finally, if you are not fully vaccinated for measles, or your children are not, go get vaccinated. Community immunity is so important. You can help not only you, your child, but your entire community by doing this one amazingly safe and very effective thing. So we hope that this information helps you keep your children healthy, happy, and safe.
Yes, this is Dr. Joanne Smith.
And this is Dr. Corinda Hankins.
Thank you for listening.